Nothing causes as much anxiety as finding out whether a plexus surgery will work or not. If that's your case, stay with this video until the end, because we're going to talk about the 4 main reasons why a plexus surgery might not be effective. Reason number 1, and the most obvious, time. That's right, if you come to me with a 2-year-old injury, even if I'm a good neurosurgeon, the surgery won't have results. Why? Because the muscles have already atrophied, and even if you reconstruct the nerve, there's no longer enough time to restore any function there. Therefore, timing is extremely important. I say that a surgeon who isn't that skilled, operating within 6 months, has a better chance of success than the best neurosurgeon operating after a year. A third cause, which I notice no one talks about, is decompression in a patient with a severe injury. That's right, sometimes a patient with a severe injury who suffered a rupture or an avulsion undergoes an electroneurography exam and is told that it was just a stretch injury, not a severe lesion. This patient ends up with a neurosurgeon or a non-specialist doctor, someone who is unaware, who only performs a nerve decompression. The patient feels reassured because the exam says it was just a compression, a stretch injury, and the doctor also did his job, so now it's just a matter of waiting. However, months go by, then a year, 2 years after the surgery, and the patient doesn't regain any strength. When he realizes it, that report of a stretch injury was actually incorrect. In reality, he had a rupture or an avulsion, and by then, it's too late for a nerve transfer. Therefore, if you have no strength at all in your arm, if your injury shows avulsion or signs of avulsion on the MRI, and your electromyography says it was just a stretch injury, be alert. Usually, stretch injuries show improvement in movement during the first few weeks after the injury. Another obvious factor, but one that no one talks about, is using poor nerves to try to recover poor functions. That's right, if you have a wire that has power, and you use that wire to restore power to another wire that has no energy, it works. However, if you take a wire with no energy to donate to another wire that also has no energy, it will remain non-functional. And it's the same thing with nerves. Whenever you're going to perform a nerve transfer, it's important that the doctor uses a nerve that still has some function, preferably one that can be tested during the surgical procedure. For example, the trapezius nerve, which is responsible for this movement, is a good donor because in most patients it is viable, and we can observe its function even before surgery by looking at the patient's movement. Therefore, if you have shoulder movement and you can perform this while awake during the surgery, this will be a good nerve to use as a donor to create a new function. I have seen cases where patients did not have hand function and a nerve from the hand was transferred in an attempt to restore the biceps nerve. In other words, using a non-functioning nerve to try to recover another nerve. Obviously, that is not going to work. In other words, this is our second leading cause of brachial plexus surgery failure. Finally, the last reason that can lead to a poor outcome after your brachial plexus surgery is bad habits, especially smoking, drinking alcohol, poor sleep, and not exercising. That's right, eating poorly, sleeping badly, and not exercising will make your results unsatisfactory. Imagine a patient who smokes a lot, drinks alcohol, and doesn't do the exercises. Compared to someone who is extremely disciplined and dedicated, the outcome after 1 or 2 years from the injury and surgery will be drastically different. This cause is yours. It's not the doctor's fault, nor is it due to a surgical error. It's something you can change from now on to achieve a good result. If you enjoyed this content and noticed that there's very little on YouTube about brachial plexus injuries, help me out by liking this video and following our channel.